today we have a delightful guest who is one of my favorite skincare experts in the entire world, I have to throw, Julia Hunter.
Inflammation. So what ages skin? Okay. Number one is every day as we're aging, it's all about inflammation, which is why I am all about anti-inflammatory, both internally and on the surface of your skin. People worry horribly about sun. Yes, sun. The problem with sun is inflammatory.
Can you just tell me what you feel about the sun, honestly, Julia?
Well, look, I mean, there's always the question of, oh, do I get my vitamin D from sun or from taking the supplements? Okay. Because sun is inflammatory, and especially New Zealand, Australia, Tasmania, all those places, they are so close to the equator. The sun just burns through and it goes down and it mutates your DNA. Never mind, it's breaking down the collagen as it goes down, killing cells, etc. So yes, SPF in a block, okay? And a block is zinc, much better than titanium. The more zinc, the better. There's zinc clear. There's all sorts of non-white zincs that you can use because you need a block. But you need a layered block, high dose vitamin C. What is that? That's a sunblock because it's anti-inflammatory, but the skin uses up vitamin C so quickly. It's why you need to take a high dose internally. It's why you need to put it on the surface of your skin. And
I mean, just going back here, because there's something around vitamin C, which I find, I don't know where it came from, but I do know that some women think, oh, I can't wear vitamin C during the day. And I'm like, are you insane? It's one of the best sun protectors, you know, after SPF to have it on. But can we just talk a bit more? I mean, you and I could talk about vitamin C for 19 hours, but for people to understand also that there's different types of vitamin C. So when somebody says, Norma's saying what's considered high dose vitamin C, personally, you and I like refined powders or we like liposomal. I think there's some rather bad vitamin C tablets out there, which might give you like Redoxil, you know, it's a lovely fizzy moment. It's some, you know, carbonated water, you drop the pill in, you know, those kind of ones. Versus
a fizzy moment does not make for therapy. And you've got to go for the therapy. So,
all right, so
vitamin C on the market.
Because there's no point taking it if you're taking the wrong shit. So
correct. You're wasting your money.
The wrong way to take vitamin C.
Okay, so the strongest vitamin C on the market in today's world that's available commercially is Camu. Okay, it's a natural form of vitamin C. Now, it's usually 3,000 milligrams per tiny little teaspoon, not a real teaspoon, but a tiny little teaspoon. Now, apropos of your New Zealand, Australian people, the Aborigines are the only people in possession of the strongest vitamin C on the market. There are people who are trying to bring it to market, but it's not on the market yet. It will soon, I would say in the next year or so, probably be available. But for now, Camu. The other one Camu, okay? Yeah. And so more is better. I mean, there's a reason that, and you need to take it every day. So apropos of IV drips versus taking it every day, look, your body needs anti-inflammatories every day. Every day it's inflamed. And depending on your mood, depending on how much stress you have, depending on how much sleep you get, depending on, you know, how much sugar you're eating, depending on what you're putting on the surface of your skin, depending on how much pollution you're breathing, etc., depends on the amount of inflammation you have per day. So you have to protect yourself every day.
You do a lovely Camu. It's quite difficult to get. I mean, I like, I have another vitamin C that I like. I'm just going to say as well, which is if you're in an called YourZooki.
Yeah. Okay. So fine. There's all sorts of lipospherics. They're usually 1,000 per little packet. Okay. And so one of you have to work up to 3,000 a day because it's a form of vitamin C that will sometimes irritate some people's gut. I mean, you and I can take anything, okay, and do well, but some people will get a little bit of diarrhea from it. And so they have to work up to it. They start with 1,000 a day, do that for 2 weeks, go up to 1,000 twice a day.
Tricia is saying you can overdose on vitamin C. And I was obsessed with that man who wrote the book on vitamin C and got himself up to 10,000 milligrams a day.
Yeah, well, that's Linus Pauling, but
Linus Pauling, exactly.
You can look, you cannot overdose on vitamin C. It's a water soluble vitamin. Okay.
Yeah.
So if you take it, what happens, it's like if you go and get an IV drip, it circulates one time, your cells grab as much as they can, and then the rest of it goes into your urine, and you have nice yellow urine. Okay.
Yeah.
Which is why dividing it over the day is a better thing to keep your blood supplied. Now, when you put it on the surface of your skin, what happens is, if you're using the right kind, it goes in, it sits outside the cells of the skin, and the cells can then use it as they need it. Okay. But internally, your body is so greedy for vitamin C. Now, the strongest antioxidant after melatonin, and melatonin, by the way, is very anti-cancer, which is another reason to take it. But if you dream and you're young, you don't need to take it. It'll give you wild dreams, and you're wasting your money and your time and your trust. The second step down position is glutathione. Glutathione, very anti-COVID. Glutathione, incredibly anti-aging. Glutathione, anti-cancer. And what I mean by anti-cancer, I don't mean it prevents, it helps prevent. Okay. Then comes vitamin C. Okay. So the more you take, and of different kinds, because the body uses different anti-inflammatories differently.
How many of you know about microbiome and skin barrier? Because I think it's confusing, and I'd love you to give us a little science lesson, and then what we can do to protect that.
Okay, so basically the pH of the surface of your skin is supposed to be acidic. The interior of your skin and body is supposed to be alkaline, but if you're too alkaline, it means your adrenals are low and you're all stressed out. Okay. And we look at that through urine. But so the surface of your skin is supposed to be acidic. And why? Because bacteria, viruses, and fungus, pollution, everything else is hitting our skin 24/7 as we walk around, and it acidic kills. Okay. And so it kills bacteria, any sort of organisms. It helps kill those organisms on the surface of the skin. So if you have a little cut or an open pore, they can't get in. Okay. And then the second barrier is you have these lipids. It's why you don't want your skin to be too dry, because the lipids in your skin help protect against the entrance of things, organisms. Okay. That also is a protective barrier, basically.
Which is your skin barrier. So your skin barrier is
part of the skin barrier. Yes. Okay. And so what toxicity means is inflammation. And look, people are putting probiotics, whatever, on the surface of your skin. Those probiotics on the surface of your skin, it's like putting zinc on the surface of your skin. It basically is a barrier as well, but it's a barrier to sun. Okay. It sits on the surface of your skin, that sort of barrier. Vitamin C goes in, it acidifies on the surface, it goes in and alkalinizes, but it's a barrier as well. So when you want to renew your barrier, when your skin on the surface is inflamed, both from stress, rosacea. What is rosacea? Internal inflammation, probably gut inflammation is that's definitely the cause. It's gut inflammation. But I've got patients who I can wipe out their rosacea. They get all maximally stressed out, and back comes their rosacea. So rosacea is definitely contributed to by stress. So your adrenals matter. And you then have to find something that helps people can get inner peace during the day, never mind, psychologically and self-discipline, whatever, recognizing that you got it. There's some products out there. I mean, beside Adrenal Life Force, look, I can give somebody a big plug with something that I use increasingly for patients of mine who are so stressed out in today's world, who are also on Adrenal Life Force. But you got to put out the inflammation. That is a high dose, full of antioxidant serum. Okay, that is vitamin C because it's anti-inflammatory, but you've got to get control of it internally.
Yeah.
Otherwise, you'll never fix the problem externally.
And I think that's something that is really, we couldn't reinforce enough when we have these discussions, Julia, of people, because there are a lot of people who on our channel who have rosacea, and it's very difficult, you know, it's difficult to hear it's what's going on inside. But I think our body physically just reacts to stress in different ways. You know, some people might get a runny tummy, some people might get rosacea. It's just,
and it's also some people get eczema. Yeah,
some people get eczema.
All
it's just
those
how your body
deals
with it. Yeah, so it's.
But also, you are what you eat. Look, the reason sugar does inflame, absolutely. It's not that we can never do anything sweet, but fruit is a better choice. Okay, not dried fruit, but fresh fruit's a better choice because look, we all need something to make us feel better. Okay.
Would keratosis pilaris also benefit from having anti-inflammatory diet?
Keratosis pilaris has a genetic component, and remember, aging has a genetic component as well.
Yeah.
Look at your parents, look at your grandparents. Where do they age? Is it around their eyes? Is it their neck? Whatever. So inflammation enhances the progression of your genetic challenges. And so keratosis pilaris, a lot of times people who have keratosis pilaris have low thyroid, so you have to look at the thyroid. Keratosis pilaris has a genetic component. It's about the little hair follicles, which have a sharp edge. The little hairs are coming out of the hair follicles. They irritate the skin. And so does anti-inflammatory help that? Yes, so does exfoliation. Look, getting in an Epsom salt bath helps that because salt anti-inflame and helps cure the bacteria that get on the surface.
This is a question I know you answer. Do you recommend bioidentical hormone, testosterone, estradiol, and can it affect your skin and hair?
Well, look, what do I say to my patients who I'm giving bioidentical hormones to when they say, when do I stop? I say, when you get ready to die, you stop your hormones, okay? Because it slows down the clock, it turns back the clock, but it has to be done correctly. It has to be done, look, estriol, you put it on I have patients who are putting it on the surface of their skin, it plumps up their skin, okay? You can't use it if you've had breast cancer. I mean, some people do, Suzanne Summers does, but you know, most of us err on the side of caution. But yeah, I mean, do I use testosterone, DHEA? One of the things that a lot of people forget is, look, the body's an orchestra. You got to do all the hormones. You got to look at DHEA, testosterone, progesterone, estradiol, and estriol, and estrone in men and in women.
Yeah.
And dihydrotestosterone. You got to look at all the pieces of the puzzle.
I think that the biggest difference between your UK patients and US, but I mean UK and US, and there's lots of other countries around the world here, but I'm just giving the two, is that in the US, you can have a lot of blood work done. It's part of your payment plan. Here in the UK, you know, this is another whole big subject, Julia, but there are many GPs who are great with menopause, but many GPs who literally won't do any blood work. So it's very difficult if you're on the NHS to actually have blood work done unless you have a really great GP who says, let's just check everything. Then it's about going privately and getting this stuff checked and then having and it costs money. But I'm just saying that it's worth getting, you know, I've had my blood work done sort of every 2 years for the last 10 years to check what my levels are and everything. And I can't advise it enough because then you take control of your body.
Look, one of the most important things, adrenals and thyroid. Okay, thyroid is the gas for your entire body's car.
Yeah.
Every organ, every cell that doesn't have thyroid. One of the things that I see in the UK is they don't do T3. T3 is the active form of thyroid hormone. I do a T3 prescription cream, which you put on the surface of the skin. Why? Because you put things on the surface of the skin, you take them internally, okay? It helps burn fat. And so thyroid, and again, in that critical info on my website, gives you all the symptoms of low thyroid. Sometimes when people are tired in the afternoon, it's thyroid, not adrenals, okay? But the adrenals and the thyroid, and they're best friends. And so you have to treat both of them.
Yeah.
Thyroid, incredibly important for anti-aging. for keeping your hormones good as long as possible, keeping your immune system, powering your immune system, and it's also powering your anti-aging.
Julia, we've come to the end of our time. I mean, I think we've only opened, you know, we've opened a tiny bit of the door, and I feel that this talk was very much about, you know, slowing down the path of time by how you look after your body internally. More than those superficial moments of, hey, my jaws are sagging, I've gone past that stage, what's the treatment? So I'd love to do a part 2 with you, Julia, where we can go through.
We should do a part 2 because that's important too.
Julia, as always, it was such a pleasure talking to you.
My pleasure.
Thank you so much for coming on. All right, darling.
Okay, much love. I'll talk soon. Goodbye.
Bye, everybody. Bye.